Chris McCann from Elko Ambulance. Go ahead and admit it. Well,
Mike takes care. Mike's been taking care of that.
Okay, we're unmuted.
And we are recording.
Hello, everyone. Can you hear us? Nod. Hello. There. Thumbs up. Wayne, thank you.
Yep, loud and clear.
So, everyone, Dr. Carrison here will start the meeting with a roll call, please. And Jen is not here, so Mci will be doing the roll call.
Yes. Dr. Del Carrison.
Present.
Carl Buttoff.
Present. Good morning.
Sean Burke.
Present.
Bobbie Gola. Bobbie Gola.
Bodie, you're muted.
I know he's present, yeah.
Can you unmute
Bodie,
Bodie?
unmute. Bodie? Well, let's continue. We come back to it.
Dennis Nolan. Marcus Dorsey Hurt.
Present.
Stephen Town. Stephen Town.
Steve was
Can you scroll down
on
those
there.
things? Okay. He's not there anymore. Okay, who's next?
James Wohler.
Here.
Bobbie Sullivan.
Present.
Douglas Frazier. Dr. Douglas Frazier. Dr. Frazier. Laura Palmer.
I'm here.
Julie Hunter.
Being admitted.
Michael Balalu.
Oh,
Bolalu.
Present.
we tried.
Appreciate it.
Bobbie Gola. Marcus Dorsey
You already
Hurt.
got him.
Oh no, Stephen Town.
Hey, Nikki, I do see Stephen Town is raising his hand in Teams. He might be having an issue with his microphone.
Excellent, thank you. That does make sense. Okay. So we just need Gola and that one.
Just text Steve. Let's see. Bodie just texted me here.
Oh, excellent. So we have 7. We have a quorum.
Okay, thank you everyone for being here for the meeting. We have an agenda with a lot of information and only three items to vote on. So the first item is a public comment, and at the EMSC meeting, we had a presentation from Wayne Boone, I believe, and Wayne is present, and so we would entertain Wayne making public comment with regard to the information that he provided us. I felt it was very important information. So Wayne, really appreciate you taking the time to be here again today and make a presentation to this group. So you can go ahead with your public comment.
Awesome. Thank you very much for having me, everyone. I appreciate being able to be here. My name is Wayne Booz. I'm a program officer with the Helmsley Charitable Trust Rural Healthcare Program. The Helmsley Charitable Trust is a private philanthropy, kind of like the Ford or Gates or Robert Wood Johnson Foundation. I have the privilege of working in a sphere where our goal is to increase access to high quality health in rural America. We've been granting for a little over a decade in the upper Midwest, And to date, we've given away about $500 million in that area to improve access to rural health care. Earlier this year, we did a landscape analysis and discovered that Nevada fit a lot of the criteria that Helmsley had for trying to improve care. And thus, early this summer, we started looking at potential partners within Nevada to start advancing our mission of providing that care. I get the privilege and have the clearance to let you guys know that we're actually going to have a big announcement here November 2nd, a joint announcement in Henderson at the St. Rose campus at 10 a.m. and at 1:30 p.m. in Reno at the Renown campus for some major grant work that we're doing throughout the state. You're all invited. If anybody would like, please follow up. I'll happily send you contact information and attendance information. My job specifically within the rural healthcare program is to work on improving cardiac systems of care. And as part of that, what I've been doing with the good folks, Mike and Bobbie, is to try and get one of our initiatives started in Nevada, which is to get AEDs into the hands of every law enforcement agency, every state park, national park, Bureau of Land Management, pretty much any first responder that we can think of that comes when 911 gets dialed, in a more comprehensive effort to try and improve our response to cardiac arrest. I'm really excited for this project. It's looking to be pretty darn huge. I just got confirmation from Highway Patrol that they want to participate with us, so I'm super excited for that. And the big takeaway for this is, like, this is our first foray into Nevada, but we're committed to trying to make this a better place to live, work, play, and to make sure that where you live doesn't determine if you live when you have a medical emergency. The wonderful work that we're doing is trying to strengthen connections between law enforcement and EMS, but we've also got a lot of other ideas of how to help bolster EMS. And some of that is some pretty low-hanging fruit that we've done in the upper Midwest, like helping get EMS agencies training and equipment for mechanical CPR. We've done some work to improve protocols for STEMI recognition and transport to appropriate treatment centers, those kind of things. And we also just really want to mine your guys for ideas of what else we can try to accomplish to make that system of care better and to ensure that it doesn't matter where you are, you've got a strong community response when a medical emergency happens. So that was a lot of information in like 3 minutes, but I'm here to answer any questions you guys have, to let you know that Helmsley is here, and we're going to try our best to help and to, you know, try to work as collaboratively as we can to make life a better place in rural Nevada.
Well, that's one of our missions of this EMS Advisory Committee, especially in rural Nevada, because that is where the fewest resources are. Formerly, I was the chairman of the Medical Advisory Board in Clark County, and Clark County has so many more resources than everyone else does. And even though Washoe is here with us, it's still a metropolitan area, and the rural Nevada is really underserved. So we appreciate your efforts in that, and I'm sure a lot of us will look forward to working with you. Do any of the members have any questions for Mr. Bone? Well, we will provide.
I'm sorry, this is Marcus Dorsey Hurt for the record. If you, I'm sorry.
Provide us with those meeting dates again, please, and then we'll see if we can get a turnout for that. Okay, sure. Thank you very much for being here.
Look, because Mr. Hurt, you had a question?
Yeah, it's actually already been answered. Yeah, contact information and you know, the events that you're planning would be great to have on hand.
Okay.
I also see a hand raised. Bobbie, I don't know if you can see that.
No hands.
Chief Nolan has his hand up on the virtual meeting.
Okay. Dennis?
Actually, no, I have my question answered as well. Thank you.
Okay, thanks, Chief. All right, Wayne, I guess that's it. Thank you very much.
All right.
Any
yeah,
other
I'll
members
forward
of
that,
the audience have any trouble public comment? So hearing none, we'll move forward with the agenda. For possible action, approval of minutes of the meeting of the EMS Advisory Committee of June 16th, 2021. Do I have a motion for approval of those minutes and any editorial comments, or if there's misspellings or something like that, please just notify Mickey and we'll make those changes. But are there any substantial changes to the minutes of June 16th? Hearing none, have a proposal.
This is Marcus Dorsey Hurt. I'll enter a motion to approve the minutes.
Second?
Chief Nolan.
Did you get it? Okay, great. All in favor, signify by saying aye.
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 Any opposed? Okay, thank you. Motion carries unanimously.
Mr. Chairman, this is Steve Town.
Steve Towns.
Steve?
I was just making sure that you guys can hear me. They muted everybody, so you have to press *6. So I am present.
Did you hear that, Kim? *6. And mute people in the whole list. Now you gotta mute it. *6 will reverse.
Do you want me to do that now? Or?
No, it's fine. Okay. He just wanted to know if we could hear him.
Okay, Steve, yeah, we hear you. Thank you. And I should have made a comment. Thanks, Steve, for the difficulty running a meeting that he had experienced secondary to COVID, and I think he did a great job. And it's a privilege to be the chair now that Steve's gone, and did an excellent job during his term. So thank you, Steve. Informational only next. Bobbie Sullivan.
Thank you, Mr. Chairman. Bobbie Sullivan for the record. This morning, we'd like to introduce two new staff members that have joined the EMS team recently. We have Anthony Parenti, who will be taking over the Emergency Medical Services for Children's grant. And we have Douglas Oxborough. He's going to be helping us with licensure and working on our licensing portion of Image Trend. So right now they're in their orientation portion and we're getting them dialed in and all up to speed. So you'll be seeing communications from them shortly as they become more involved in the day-to-day tasks. At the last meeting, there were suggestions on changes to the inspection form, and we took those into consideration, made some of the typographical changes. We are going to leave the form as it stands for now because it's been cross-checked with the National Association of Emergency Physicians and Pediatricians, and most of those items are in alignment with their recommendations. However, two of the other suggestions that have been added to put onto that form was to include a checkbox for use by the agency and by the EMS office to show whether or not an agency has applied for and received a variance. We had one variance approved at the Board of Health meeting, the last Board of Health meeting. We have two variances that are pending approval, so this will be a smoother way of tracking those variances. We're also going to include a portion so that we can assure that agencies who are doing blood glucose testing or antigen testing for COVID have received the appropriate CLIA waiver from the federal side and then the exemption waiver from the Nevada EMS office. And that's all I have at this time.
Okay, thank you. Any questions for Ms. Sullivan?
Yeah, this is Dennis. I just maybe wanted to ask Bobbie to share a discussion that we had earlier with regards to the CLIA waivers that agencies get. And in our case, Reno Fire Department, we've been doing a lot of PCR testing, you know, not just only for our fire service, but city employees and police. And there had been a request at one point to kind of expand some of that testing to different city departments, which is something we resisted, and just because we don't want to lose that span of control. And so in talking with Bobbie about it, I think that there was either some consensus or at least some precedents for, keeping that that testing within the agency that had applied for the CLIA waiver. And Bobbie, I don't know if you want to expand on that a little bit.
Thank you, Dennis. Bobbie Sullivan for the record. Dennis, you've covered it pretty much in the discussion that we had, and I'm in agreement that keeping that testing within your organization, if you lose that span of control, then you've got testing occurring that you're not overseeing. And they're also not part of your organization for the training records and everything else that coincides with that. So I think it was a great decision on Reno Fire's part to keep that testing within their team and their membership.
Okay, and Bobbie, thank you for chairing that committee. Item number B, or 4B, update on the activities of the Emergency Medical Services for Children, EMSC Advisory Committee. Michael Bogaloo, EMSC Program Manager. Mike?
Good morning, everyone. Thank you, Chair Michael Bogaloo, for the record. Bobbie kind of stole my thunder in her update, but our big announcement for the EMS for Children's program within Nevada is we have hired a full-time program manager, Anthony Parenti. And I would offer at this time, Anthony, would you like to introduce yourself to this committee as they play a vital role in our program?
Yes, I'm Anthony Parenti. I'm from Western New York, where it rains quite a bit like it did this last Monday. And I've lived in the Reno Tahoe area about 30 years. Got a background in sports management. I worked with an engineering consultant, geotechnical materials testing. Most recently, I've had a tenure with technology sales. I'm from Malta Pacific office. Got an MBA, public administration, 2014, and experience with open public meeting and grants administration. And I look forward to contributing to this organization. It's great to see some faces on the teams, and look forward to meeting everybody.
Michael Bowl for the record. Thank you, Anthony. We look forward to working with you.
Mike, did you want to report on anything in the activities from the meeting?
The EMSC program has been without a full-time program manager for a while, so our hands have been tied. Given that we have approximately 5 months, almost to the day, to the end of our federal fiscal year, which ends March 31st, 2021. I'm sorry, 2022. Geez, I can't believe it's already 2022. We're going to prioritize purchasing and acquiring pediatric restraint systems for ambulance and fire-based EMS services within Nevada. Anthony and I will be working on a survey to assess the need for that sort of equipment. And this is not inflatable car seat restraints or anything. This will be a 5-point restraint system that attaches to your gurney, so you can effectively transport any pediatric patient with or without a car seat, and without utilizing a backboard. That's what we're going to be prioritizing for the remainder of this fiscal year. And April 1st of 2022, we're going to be prioritizing and looking to fund advanced airway training for field deliveries with LMAs. That will be provided by Dr. Lloyd Jensen out of Southern Nevada. He's put together a training, webinar type training, but that training does require certain equipment, LMA specifically, eye gels, etc. If an agency doesn't have that in their protocols, that will need to be updated, and the training will need to be provided to those services prior to be putting those in place. So that's going to be a pretty hands-on deck project for Tony and I, but that's what we're looking forward to providing you guys moving forward in FY23, which starts April 1st of 2022.
Excellent. Any questions for Michael? Thank you very much for the presentation. Item 4C, update on the activities of Southern Nevada Health District and John Hammond, who is on vacation, for EMS and Trauma Systems Manager. And Laura Palmer has graciously stepped in to give us an update on what's going on in Southern Nevada. So, Ms. Palmer.
Good morning, everyone. Things are a little bit quiet for us, and I kind of knock on wood when I say that. We're in the midst of trauma regulation review But other than that, it's kind of a situation normal for us right now. We're just waiting for the new year to start.
Okay, so no increase, the Delta variant has gone down and you guys are back on track again with the COVID?
We are, in fact, we had put in emergency protocols and some emergency medications in the middle of last year to address the COVID response. And as of our last medical advisory board meeting last month, we removed those drugs from inventory and we removed the emergency protocols. Our numbers have stabilized and we're pretty much back to normal business. Transports are about where they have been historically for this time of year.
I guess the only other question I'd have, if you have any comment on EMS provider shortage in Southern Nevada?
You know, that I think is a thing that we are constantly fighting. We are doing our best in the office to keep those people rolling through the doors, and our training centers have really been trying their best to meet the demand. It's a constant struggle.
Okay, thank you. Any questions for Ms. Palmer? Okay, hearing no questions. Thank you, Ms. Palmer. Appreciate you taking John's place.
No problem.
4D, update on the activities of Washoe County Health District. Julie Hunter, are you present?
Yes, I am. Can you hear me?
Yes, hear you very well. Thank you.
Yes, thank you. Julie Hunter for the record. Some quick updates from the Washoe County Health District EMS Advisory Program or Oversight Program. We will begin, last time I spoke on the MAEA updates were completed. We will now begin training on the MAEA at the various facilities, starting with the hospitals and then going to the long-term care facilities. That will start in November. I will be co-training with REMSA, Brian Taylor with REMSA. The MCI updates and workshops are underway. As I mentioned, the burn annex will be added as an appendix. Some big projects we've worked on is the EMS annual report. That will be going to our EMS Advisory Board on November 5th. And that will include fiscal year 1920 and 2021, as 1920 was not able to be published due to COVID. So we're going to do some catch up on that. We're also currently reviewing the fiscal year REMSA franchise map. And that will also include the 2020 population census data from 2020. We continue to, of course, gather the compliance data for REMSA and their compliance for their franchise agreement. Thank you to the state for helping me work with those items that I need letters for, so appreciate that. And then, of course, ongoing work with the EMS partners to accomplish goals from the EMS strategic plan, and we are reporting those accomplishments to MSAB, the EMS Advisory Board, on a quarterly basis with recommendations to take those to the District Board of Health for their final approval. One big accomplishment was to determine which determinants can now be going cold response, which is no lights and sirens, for psychiatric and behavioral calls, as well as unknown man down. So we did quite a bit of analysis on the percent volume of those calls, and those responding to those with no lights and sirens makes it safer for staff and citizens as well. Those are my major updates. Any questions? Sorry, my camera's not working. Apologize.
Well, you're very clear with us. Any of the members have any questions for Julie, Ms. Hunter? Okay, thank you very much for that update.
Thank you.
Item next, 4E. Any members have any updates from their particular EMS agencies? Nothing, everybody's fully staffed, everybody's responding to calls, no problems.
This is Marcus Dorsey, heard for the record. Of course, Remsa Health and CareFlight, we are struggling with staffing, just like most of us, I think. Call volume is still high. We are struggling a bit also with offload times at the hospitals. Working with the hospitals to improve on that, and it has improved already, but we are still having, I think last month we had about, I want to say around 800 hours of wall time for the ambulances. So that does not help to keep our resources in the system. Again, it's multifaceted. Hospitals have the same kind of staffing issues we have, and hopefully all of that is going to improve. We're hiring a lot, trying to upstaff everything again, and it's hard to do right now. Pandemic still going on. I think we're getting down countywide down to like the 9%, about 9% positivity rate. So it's improving, but we see at times upticks, and then it comes down again. There is no real pattern right now. Hopefully, with booster shots, we'll see some more improvements. That's it for me.
Thank you, Marcus. Appreciate that. Anyone else with an update for their?
Bobbie Gola for the record.
Bobbie?
Yeah, so it says it's City of Ely Fire Department. We have 2 open positions we're looking to fill with paramedics and get them in and teach them for fire. We also added 2 additional auto pulse devices to our ambulances, so our complete fleet has auto pulse devices. And then we also were granted a variance due to the limited staffing to implement fentanyl usage to our advanced EMTs. So we're kind of going through a lot of those changes right now. So other than that, we're still doing pretty good with COVID. Not a whole lot of cases down here in the county. So that's what we got in Ely.
Thank you, Bobbie. And Dennis, did you have something?
Maybe just real quick, Reno Fire, we have received SAFER grant funding to actually restore some positions. Reno Fire lost about 50 positions during the recession between 2008 2013, and those had never been recovered. And with the SAFER grant funding and funding from the city, we're looking at restoring by the end of next year about 30 of those lost positions. We are starting an academy in 2 weeks with 20 persons, which for Northern Nevada is a pretty big agency academy. And then we'll start a second one about 3 months after that. So doing that, we also had requisitioned a new ambulance, but because chassis were hard to come by, we just received notice after waiting for about 9 months that the manufacturer had received chassis. So we're hoping that that will go into a build out, and we might see that by the end of the year, if not the first part of the year. The only other thing we're doing is working with our medical director, Dr. Watson, and we'll circle back around to the health department on just changing up some of our pharmacology. We're looking at dropping morphine. We have plenty of other narcotics to get the job done, and I don't think we've administered morphine in years probably, but we still buy it. Always a discussion about whether or not we should be spending the money on Decadron, or I'm sorry, not Decadron, glucagon, and we're not very rarely using that. And we'll be looking at going just to duonebs. We currently carry separate isopropium bromides, and we're just thinking that the use for them would be better if we just had single duonebs. But other than that, that's about our only update.
Okay, thank you, Chief Nolan. Any other members with EMS updates?
This is Steve Town. Ben or Churchill, we're we're struggling with staffing. We hire some, and then some walk out the door, like Chief Nolan referenced. The fire department hiring a bunch. So that's kind of what our trend has been. So if the fire department ever has an opportunity to share some money or people, Chief Nolan, keep that under advisement. One of the big things that's hurting EMS as an industry is the reimbursement. So I don't know, what we can do as a group to, maybe go through the political process and reach out. The reimbursement, really ties our hands on compensation and those kind of factors. So, we're just in the same boat with everybody else. And our call volumes, we're up 10-15% over last year.
Okay, thank you, Steve. Anyone else?
Hey, this is Carl Bator.
Carl?
Just pleased to announce that the brand new emergency room, which will become a level 3 trauma center, opens at Nellis the 1st of November. And we're fully staffed here. We're currently already accepting civilian ambulances that meet specific patient considerations from both Medic West and North Las Vegas Fire. And it's going well. It's exciting to serve the community of Northeast Clark County in that way, and to shorten those transport times in many cases.
So we understand that catchment area, will it operate as a level 3 trauma center or a level 2 trauma center, Carl?
It's my understanding the facilities applied for a level 3 certificate to serve in the northeast portion of the county. And there's a lot of details that are yet to be determined, but it moves forward.
Okay, thank you for that update.
Yes, sir.
Any members with other updates?
This is Chris, ambulance.
Chris?
Yeah, I just wanted to give an update from Elko County here. We've been dealing with a lot of the same struggles that everybody else is talking about. Also wanted to report we've had the opportunity to start up a monoclonal antibody therapy clinic, working with the county and with our local hospital here, NNRH. And we've been able to see some substantial results on very sick patients who came into us and were able to receive the antibodies and did not require hospitalization or further treatment. And so it's a great thing we've been able to achieve and accomplish out here. And we've been working really close with NNRH to try and help with their staffing crisis and the surge crisis that they've experienced. We've been able to fill in some of their immunization clinics and things like that to help relieve their staff to go and do other things that may be more demanding on them. So I just wanted to share that update from Elko County. And we're dealing with a lot of the same other struggles as well. We've still got open paramedic position. I'd say one other thing for the knowledge of everyone is we are on the verge of a transition. Lee Cabanis, our current director, has accepted a position with the county as a emergency manager. So there will be interviews for the position next week, and a transition over the next month or two, I imagine.
Excellent, thank you for that. That's good news about the antibody infusion, because there have been, in the literature across the United States, there have been some significant, excellent results in people, as you just mentioned. So it's kind of heartening to hear that that's going on in Elko. So appreciate your update on that. Also, really enjoy hearing about the teamwork and making things work. Any other members, comments?
The other thing, if I can share, this is Chris again real quick, is if anybody else is interested, we've tried to document well our process that we starting it. So we'd be more than happy to share that process and the paperwork and those sort of things. If anybody else is interested, feel free to reach out to Lee or I.
Thank you for that. That's very important. I hope all the members heard that and willing to share the information and protocols that they've developed. That's very important. Any further updates? With that, we'll go on to item number 5, informational only. Discuss the 81st legislative session 2021 as it related to any changes that may affect the emergency medical services. Bobbie Sullivan, EMS Program Manager.
Thank you, Mr. Chairman. Bobbie Sullivan for the record. There was one specific item that was brought up in the legislature, and that was for establishing mental health services for responders. And through working with Derek Reed from the Nevada Peer Support Network, he will be doing a presentation on item number 9 of this agenda. That has been able to replace that bill. So currently as it stands, there were no other bills in that session that affected the EMS office.
Great, thank you, Ms. Sullivan. Any questions for Ms. Sullivan on that? We will have that in item number 9. Okay, item number 7. I'm sorry, item number 6. Discuss any proposed changes to the Nevada Revised Statutes and Nevada Administrative Code as it relates to EMS services for recommendation to the division. I'll just make a comment there before Bobbie does. We think the legislative session is not coming until 2022, but now is the time we need to work on this. It's extremely important. So, Ms. Sullivan.
Thank you, Mr. Chairman. At this time, the EMS office is looking to update some of the administrative code items that we have within our office. And Cody, was this an item that you were going to speak to?
Thanks, Bobbie. Yeah, I'm happy to answer any questions. We have had some requests. Excuse me. We have had some requests about making changes to the statutes and the regulations. We can do the regulations before the session, but of course, statutes require the legislature, the legislative process. So we want to open that discussion. Perhaps I should introduce myself. My name's Cody Finney, and I am the Deputy Administrator for the division that now has responsibility for this program. Margot Chappell has moved to a different division, and so I took over that position. We've had some recommendations about making, for example, adjusting the administrative code so that ambulances that you all are able to bring online don't sit idle until we can inspect. So that would be one revision. I feel strongly that we need to address the, and I understand this is an area of discussion, so I need to hear from you. We need to address the calendar on which we do our cycle of certifications because the state's really gotten too big for us to do everything at one time. But I understand that has some complications. So this is really where we want to open up for discussion with the group. What are the things that make the regulation most meaningful? Our interest is in making sure that people receive consistent service, the people of Nevada, that the service is safe, that people providing the service have the appropriate training. So what would your group like to see us work on where we balance the regulatory needs with those goals with the burden that is created by regulation? I will absolutely admit that there is burden, but there is also purpose. So I see Chief Nolan has his hand up. Hopefully I've said enough to spark some really good discussion.
So thank you for that, Chief Nolan.
Yeah, so thank you, Cody. I think just two issues. One of them has been an ongoing discussion with this committee, I think, for maybe a couple of years now, and it's regarding the certification level of an advanced EMT and the requirement to be an advanced EMT in order to enter into a paramedic program. And I think that the general consensus is that a EMT with adequate pre-hospital experience should be allowed to be able to enroll into a paramedic program. Right now, it's kind of confined to just being an advanced EMT. So what that level of experience is, I think there's a number of different suggestions, probably from mild to wild. But if we maybe put a little task force together. I think we can come up with a consensus on that. And then the only other thought at this time I had for you was we several years ago, and I'm talking about 8 or 9 years ago, during the legislative session, emergency medical services were included in a bill at one time that the healthcare community had brought forward, which provided a level of immunity from discovery of medical cases that were involved in the QA process. So right now, the medical community will enjoy that if they have a case that's going through a bona fide QA review, then there's a certain level or certain firewalls in place that provide some protection from discovery. So and EMS got dropped out of that along the way, and I think that during the next legislative session, if we could bring that back to include the emergency medical service agencies, QA processes to who are reviewing medical calls, to also afford them a level of that immunity from discovery.
Okay, Dennis, I understand you're volunteering to chair that committee.
No, I didn't hear that. Glad to participate, and we'll see where that goes. But I wouldn't mind getting together with the committee.
This is such an important item because, along with changing the requirements and eliminating the AEMT, which has been brought up by a number of members, there's also a desire by the academic people, which I agree with, that's fine as long as they also have to have a course in anatomy and physiology prior to the paramedic program, because without that, there's a huge gap in knowledge that is very important for the pharmacology, for instance. But understanding the reaction to drugs and having that anatomy and physiology of that is extremely important. And you have to start from scratch, and somebody hasn't had that. It's really a very difficult problem for teaching the paramedic students.
Right.
Any other comments from anyone? We will get. I'm sorry, Cody.
Chairman, thank you, Cody Finney. For the record, I'm making a list. Chief Nolan, those are 2 additional items that I had not heard before, so I really appreciate the education on my part. I'll be working with Karen and Bobbie and the rest of the group on what we think we can propose and what we can support and work through as other people make proposals to the legislature as well. So appreciate the start of this great discussion. Thank you.
And I would be glad to help.
Go ahead, Dennis.
For all of our members, this is a very important issue, and we need the input. So please keep in touch. I think you have my email, and if not, we'll get that at the end. So we really need to have a good discussion. We can't have meetings offline. We're going to be aware of the open meeting law. However, we can certainly have suggestions from members with regard to what they would like to see, and that has nothing to do with a meeting or agendizing anything. Just your feedback is so important. So
this is Marcus Dorsey for the record. My understanding is that the requirement for the AEMT requirement to enter paramedic school is not in law. That's an administrative code. So I don't think it really needs to go to the legislature, as far as I know. That was just a comment I wanted to make.
Thank you. And if that's true, why we can make adjustments. Sullivan, Bobbie?
Bobbie Sullivan for the record. Marcus, you are correct. That item is in the Nevada Administrative Code, is not in the NRS, the Nevada Revised Statute.
So it would still have to be addressed, but a slightly different process. Any other comments? Okay, item next.
Chairman,
I'm sorry.
I'm so sorry. This is Cody Finney for the record. May I ask one question of the group?
Certainly.
So one of the issues we've heard quite a lot about is the idea of changing the administrative code. Bobbie, correct me if I'm wrong, but I recollect that was an administrative code to make sure that any new ambulances that you all bring on don't sit idle while you're waiting for our inspection. Is there any feedback from the group about that as a particular issue? We're willing to continue working on that. Again, our goal is to make sure everybody's safe, but I also don't want to say, we're going to make that ambulance sit and then find out that somebody could have been served and perhaps saved because we had a vehicle sitting. So I think there's some great opportunities for reasonable outcomes here, but I really am not an expert on EMS and would love to hear from you all on your thoughts, concerns, perceptions.
Comments from the group?
Hey, this is Zeb Nimura from Truckee Meadows Fire.
Sorry.
You guys hear me okay?
I hear you.
This is Zeb Nimura from Truckee Meadows Fire. I have a comment on the ambulance inspections. We did have, this is anecdotal of course, but we did have an incident where we were trying to put an ambulance into service due to high call volume in the area, and we ended up having to wait. It was only 24 hours, it wasn't long, and it was super convenient. Bobbie had Buck come out and check our ambulance really quick, but essentially we were just trying to get the ambulance out in service to cover a high call volume day, and Remza had a bunch of ambulances on the wall at the hospital, calling for mutual aid, and this process would be better if we could self-inspect just to get our units in service quicker.
Cody, you have a comment?
I really appreciate that feedback. It's my thinking on the matter at this point would be there would be some kind of period where you could use the vehicles until we can get there, so that we would not hold up service, but we would also have a reasonable assurance that all of the required equipment and all of those things are included. That's kind of what we're looking at right now, but I really appreciate the feedback from the group. And again, I just feel like there's excellent opportunities for reasonable solutions.
And I think something like submitting a paper, we have the forms that have to be filled out when you do when it comes out to have the ambulance inspected. The form that you have to go through, and you have to have that checklist. If you would, perhaps if that checklist was filled out and submitted, then the timing of the inspection could be later, and it can still be approved for immediate use, as long as that paperwork was there documenting that. In other words, your checklist that you have when you get inspected, if you sent that in and it was all up to date, nothing missing, then that would allow you to use that ambulance, and then an inspection within some sort of time frame, so that we could make sure that it was as submitted.
Mr. Chairman, Bob Sullivan, Cody, to follow up on that comment, that is under NRS, that is not an NAC for those inspections, so that one will take.
Thank you for the correction, Bobbie. I can't always remember.
It's harder to keep them separated, but that one is in the NRS.
It's worthy of discussion.
Add it to the
Chairman,
list.
Mr. Chairman, Carl Vator.
Carl?
We can buy it. Hi, we can buy a house now with a virtual inspection. We can buy a car with a virtual inspection. Should we consider virtual inspections in these types of situations as well? And would that meet the NRS requirement? Just a thought.
Cody Finney, for the record, absolutely worth exploring. I see Jason Nickel also has his hand up.
Okay. Then with that in mind, let's continue that discussion.
You have one more hand up.
Go, I'm sorry.
Jason.
Jason?
Am I unmuted?
Yes.
Yes.
Okay, excellent. Chief Jason Nickel for the record. I appreciate, Cody, you're talking about the looking into those NAC and NRS issues that we've been working on diligently the past few months. I do want to point out in NRS in 450B220, which talks about these periodic inspections, the exact language is that the health authority shall cause to be inspected. It does not in any way in NRS say that the health authority shall inspect. And so what we're talking about, what many of the other participants have talked about, is the ability for the agency to provide those inspections based on the request of the health authority. In the language, if the health authority gives each individual agency the regulation that they want inspected, they have in fact caused to be inspected. It never says, never specifies that the health authority has to complete the inspection, just that it has to cause it to occur. So just a point of clarification for Cody and Bobbie and everyone there.
Chairman, if I might. I certainly appreciate Chief Nichols' point of clarification and interpretation of the regulation. I'm sure, I will say, I'm sure you can all understand that having the industry do all of their own inspections can lead to some challenges. And so we want to find a balance. But I appreciate very much the input. And again, there's more hands up. So wonderful. Thank you.
Anything further? Okay.
Chairman, this is County.
I'm sorry.
Chris McCann.
Go ahead.
Yeah, this is Chris McCann with Elko County. Cody, one thing that we've brought up, and I know has been brought up for several years by Elko County, is the board makeup, which is an NRS thing, so it would require legislative change. There's no seat that we could be represented on, or any other agencies like us. We're a county-based agency that doesn't include a fire department or a hospital, and we've had that discussion several times during these committee meetings, and you know, we'd love to see an opportunity for county-based agencies to be represented on the committee. I know in my discussions with this, you know, there's no representation for those tribal units either. There's several permitted tribal ambulances in the state, and they don't have any representation either. So that's a statute issue that I know has come up in the past, and just wanted to bring that one up since we're on the topic.
Yes, thank you for that, and it's it is a concern, and it's been discussed on this. So see what we can do moving forward. And for Dr. Carson, for the record, my particular concern was that, and this won't affect me, so it's not self-serving. So the chairmanship of this committee should be 2 years, because 1 year, 4 meetings, and you're done, and you could be off the committee. And I don't think it allows for a continuity that helps the state EMS office to have the same person for at least a couple of years, because it takes a while, and that's why we kind of rotate the different members at different times so that we can have some continuity and we don't try to reinvent the wheel every year. So I would have Cody just throw that out for consideration also. Anything else? Okay, then item number 7.
Who's got a hand?
I'm sorry.
Zabulon?
Zeb, are you still raising your hand?
Go ahead, please.
Yeah, I just have one more thing. Is there any appetite to look into EMS initiated refusals or any type of immunity related to that?
I didn't hear that.
Zeb, can you repeat that?
Yeah, is there any appetite to look into EMS initiated refusals?
I am so sorry, Zeb. This is Cody Finney for the record. I don't understand what EMS initiated refusals means. Can you say more?
Mostly related to basically what we've seen during the pandemic is we got a lot of resources tied up on really low acuity calls, and having an ambulance be able to switch from those calls to a higher acuity call from on scene might be something to look into to better utilize our resources.
If I could talk to that also, maybe. Cody. Thank you, Chairman. So it has always been, and I don't know anywhere that it's been written in statute or code or anywhere else, but for EMS responders to arrive on scene of a patient, under any circumstance, if that patient wants to go to a hospital, we take them to the hospital. And particularly in recent times, even now in Washoe County, the emergency rooms on any given day are at capacity or overflow capacity, where we have to start initiating emergency processes. And REMS has been very good about doing this because we're literally, there's not enough beds in the ERs, not enough staff to handle the flow of patients. And so when you get somebody who has you could have somebody literally with a hangnail who says, I want to go to the hospital. And we've always, as a system, said, okay, you know, we might try to talk them out of it and tell them to go to an urgent care, but if they say, I want to go, we take them. And it's maybe in past times when there was more capacity, you know, you might be able to get away with that. Now it's just causing very serious system backups. It's happened before in Clark County. It sounds like they're kind of on a better path right now. But Washoe County, the hospitals here, even as recent as yesterday, Reno, Maine, and South were on emergency divert from an internal crisis that was happening. And the other hospitals just were packed to the point ambulances couldn't offload, and we're back to waiting for over an hour to get patients out. So the point is, if again we could have some statutory protection that would allow EMS personnel to tell a patient, no, that hangnail or this condition doesn't warrant transport by an emergency ambulance to a hospital. You can, there are other modes of transportation that you can seek. If you want to go to a hospital, but an emergency room is not the right place for you. And so that's the ongoing discussion right now.
And an extremely difficult discussion it is. All right, then, in the interest of time, let us move forward, please.
I'm sorry,
Discuss the timing of annual licensure renewals and new applications, Ms. Sullivan. I'm sorry, I didn't mean to cut you off if I did.
I just wanted to, Chief Jason Nickel for the record, I wanted to make one more comment on what Chief Nolan and Zeb brought up about EMS refusals. This, I believe, leads into a larger discussion of EMS abuse. The hangnail is a good example. There are multiple states, Virginia, Arizona, Washington, Idaho, that have EMS abuse statutes that do give EMS providers the ability to do almost exactly what Zeb and Dennis were talking about. And I'd like to propose that that be something that be looked at, because right now, without an EMS abuse statute, we do have to take everyone that asks to go to the hospital, which includes those people that just want to ride to the hospital because it's close to where they want to go. And that actually does happen.
Well, I think all of us know that happens. All of us have experienced the broken toe syndrome, but that also comes with caveats that it has to be, somehow there has to be somewhat of a structure to determine, you know, do that, because I've also experienced patients that clearly needed to go to the hospital and the providers chose not to take them and talk them out of it, or just refused to take them. Obviously that can be reported and there's remedies, but I'm just saying this is a topic that needs to be discussed, and there needs to be some sort of leeway, because the system is clearly abused. And I've experienced more of the abuse in the metropolitan areas than I have in the rural areas, but I'm sure it still occurs there when somebody just wants a free transport to the hospital. So we'll put that on the agenda for future discussion.
Thank you.
Thank you for your comments. Item number 7, we just got, Bobbie, would you discuss that, the timing of licensure renewals and new applications, please?
Thank you, Mr. Chairman. Bobbie Sullivan for the record. The part about the annual licensure renewals is back to Cody's conversation about discussing perhaps adjusting how we handle renewals currently. As everyone is aware, March 31st is the expiration date of existing credentials. The state has gotten too large to keep up with that volume, so the question is looking at other options for expiration dates on credentials, separating them out under some of the form, whether it be based on their issue date or if it's based on the birth date and things like that. So that's a conversation that we want to go ahead and continue. And then I'm going to let Mike speak to this. We've done some updates to the application process and how those applications are formatted to streamline the process and reduce applications that providers submit. Mike, can you speak to that?
Of course, Michael Bowler for the record. I think it's good afternoon now. It just is. We've been here just about an hour. I think it'll just be more efficient for me to share my screen with everybody so I can kind of show you. Image Trend did do a update this past week. I think it was last Monday, on how the supplemental training and education is going to be formatted within the applications within Image Trend. And I think it would be valuable for you guys to see this. I believe you should see my screen here.
We do.
And this is the same supplemental training application that any provider would go through within Image Trend. This is just an example application I'm doing here. And we used to have, as you're all probably familiar with, it was an add training button on the bottom right-hand side. That would open up the course detail. You would enter the course date, the date you completed it, the location, and have an upload. This is effectively the same spiel, but it's more visually appealing, especially for somebody like me who likes to see my progress and the progression in this bar here. So if you're a provider and you need to upload, for instance, the topics are broke out of what is required for your renewal. So you need a CPR card, you need CEUs unless you have a national registry card in lieu of those CEUs, and you need a skills verification. So there's an upload required for each of these. You simply hit the green button here, the add button. This is where you'll enter your course name, CPR card. We'll say I did it yesterday I know we have Marcus here, so I'll say I did it at Remsa, just as an example. Now we do require a file upload as a certificate. I know this has been a topic of discussion. I'm just going to upload the dummy skills verification sheet for an example, and then you simply add in, the 4 hours that a CPR course is worth. You hit add, and then visually you'll see you completed 4 of the 24 hours of total requirements. I have 20 hours remaining based on CEUs, a skills verification, and/or national registry. And then you would go in and effectively add your CEUs and documents that way. And as a provider, if you open up multiple CEUs, you hit this black drop-down arrow, and it'll show you what course you uploaded, how many credits you put in, the date it was completed on, the document, so you can verify that upload was correct, and then you can also delete it if it was an error. This is effectively the entire change of the application. This also is in the initial certification applications, as long as the reciprocal applications and the EMS renewal credential applications. But that is the update as far as the Image Trend goes. Does any of the community members have any questions for me?
Any questions, comments? That's a significant improvement.
Yeah, and actually, Chair, before I go, we all know that we go in here. You can actually see the percentage of where you're at as far as your education goes on your login page as well. So they've added this third box that shows you the amount of hours and the percent you are completed in my EMT renewal. Now, if you had multiple applications within that, you can actually look and see your application level for your initial certification, is this complete? Your initial attendant license, is this complete? You may have an instructor endorsement application. That's all going to be visible here as well. But that is it. It's a small update, but I think it's gonna straighten everything out. It's a lot more visually appealing, and it's a lot more straightforward.
Any questions for Michael? Thank you for that presentation. I would encourage everybody to take a look at it. Just click in and use yourself. We all have that.
Yeah. Chair, I'd also offer if anybody has any questions, feel free to reach out to me. Probably emails by best. If everybody in the committee sends me voicemails at the same time, might be hard to catalog. But if you have questions or want me to go over the system or you're having issues with it, feel free to reach out to me by email. It's listed on the staff listing website within the EMS webpage, and I'd be happy to assist anybody.
That'll be Doug. He's gonna be good to see.
Okay. Item number 8, discuss points of contact with local emergency medical services agencies within the state EMS program. Ms. Sullivan.
Thank you, Mr. Chairman. Bobbie Sullivan for the record. We're going to continue with the health EMS and health.nv.gov address to contact staff for now while we're still completing training. With Douglas and Anthony on board, hopefully by mid-November, we're going to have one additional team member added to our complement of staff. And as we get everybody trained up, then we will revisit staff being assigned to certain tasks. So I'll keep you updated on that.
Okay, thank you. Number 10 for possible action. I'm sorry, number 9, thank you. Presentation on available mental health resources and services for first responders and hospital professionals. Derek Reed, Mr. Reed, thank you so much. He's president of the Northern Nevada Peer Support Network. Very, very important position.
Yeah, good afternoon, and thank you for having me. It's an honor to be speaking to all of you. And first off, is everybody able to hear me okay?
Yes.
Clear here.
And if you would be so kind to allow me to share my screen, I have a brief presentation that will help help explain about the network. And let me see if I can figure out. I know that to share your screen.
Are you on the Teams? Can you see everybody? Can you see yourself and the participants? So right next to the leave button in the upper right-hand corner, there's a box with a black up arrow.
Yes.
And you go ahead and click that. That'll enable you to share content. If you have multiple monitors, you'll have to select which monitor you wish to share.
Okay, I think I accomplished that. How did I do?
No problem.
Oh, I don't want to bore people already. Are you able to see my screen?
Yes.
Yes.
Okay. All right. Well, again, thank you very much. My name is Derek Reed. I am the president and founder of the Nevada Peer Support Network. I'm also a battalion chief, Truckee Meadows Fire and Rescue. I did develop the mental health and wellness program for them. I sit as a chairman of the Behavioral Health Committee for the Lake Tahoe Regional Chiefs Association. I also do some deployments out of the area for the IAFF on critical incidents like the transit shooting down in San Jose. We were up in Talent, Phoenix, and Oregon last year doing peer support for the departments that were affected in that major fire. To get to the Nevada Peer Support Network, we do and we are exclusive to first responders, mental health and wellness. We established in December of 2019. This was the catalyst for this was, we all have a story when it comes to why we do things as impactful as I think the network has been. We did lose a member in 2019, and we didn't know what our resources were for helping us kind of get back on track or help us through it. We were clueless, and we also had issues within first responders, and most people don't know who to reach out to when they have somebody that has a substance abuse problem or is going through problems in their most important relationships, like their significant others, their marriage. There's just a lot of things out there plaguing first responders, and when I say first responders, I mean all of them. We're talking fire, EMS, 911 dispatchers, military, hospital professionals. Recently, we just brought on a hospice group. They wanted to be a part of this program, and I had to ask them, well, I got to help me wrap my head around how to bring you into a first responder group. And when he started throwing out some of the statistics of suicides of hospice workers and started explaining to me what they do for a job, I was like, well, I'm convinced. It's a lot of trauma that a lot of us are facing out there, and it's manifesting into not broken people, but people that need to get back on track. And that's all that it is. But there are no resources out there for pre-incident education and training. And that's largely what we do with Nevada Peer Support Network and the networking itself. To keep it all inclusive, our board of directors are made up of different service branches, and they're boots on the ground. They're not in management. They're not with the state. There's no legal obligation for us to be doing this. This is specifically because we know what our members need. It's coming from the bottom up, and we put those people on the board that have that understanding of what's happening with the boots on the ground. So we have a couple hospital board of directors. We have a colonel with the military, Cameron Wagner. He's a sergeant with Washoe County Sheriff's Deputies Association. And to back that up with credentials, Dr. Stephen Nicholas, which is, he's a lot of things to me. He's a mentor, he's a friend. He has the ability, he's not a first responder, never has been, but he has the ability to connect with all first responders. I just left a police convention at the Pepper Mill before I came to this meeting, and I sat and listened to him give a talk to about 50 law enforcement officers about mental health. I'm not sure if you're connected with law enforcement, but that's a tough group to crack. And he was very welcomed, and he was able to connect. He also is an author. He's what we call culturally competent, and he is trauma informed, and he's pre-incident focused. He's about living ideations, as his book says, rather than trying to fix what we categorize as broken. He builds. His mindset is on the health and wellness model, not the illness model. So he's a huge part of our network. Our values, I'll talk about one, and that's inclusivity. We have obviously others, but inclusivity we truly hold as a core value because it is all inclusive. It's metropolitan, it's city, it's county, and most importantly, it's rural. And I had a discussion with a person out of Wendover today, and we're getting connected. We're going to get their resources connected with ours. So we know who they are, they know who we are. They can access the website, which is basically an infrastructure for all first responders, peer support teams, CISM teams, chaplain groups. In 2019, when I asked, I don't even know what we have for resources. Now we fixed that problem, and they're vetted by first responders, boots on the ground, and they're all included, as I stated before. Who do we serve? We serve EMS, fire, law enforcement, like I said, dispatchers even. Dispatch is one of those ones that I described in a class that I taught for TMCC paramedic students yesterday. I said that they received the call, let's say of a choking child, and then, EMS shows up. They say, okay, we're going to hang up the phone now. And that dispatcher now has no idea what happened with this choking child. And they're probably the worst thoughts that you can possibly imagine from a child not breathing. These are individuals that we absolutely are, we bring into the fold. Ski patrol, that sounds like a fun job, but, last year, the year before, they dealt with fatalities, and they're part-time employees. That's something that they just were not trained to deal with, and on the other end. And most importantly, we recognize the families. the first responder, that's an occupation, that's a job. I think in the past, some of us old school people think that, that's who we are. We make that our identity. It's not, it's what we do. Who we are is when we go home and interact with the family. And there's a transition piece in there that needs to be an educational piece with our first responders. And that's that transition from what we call an honor-based culture to a pride-based culture. It's very interesting that some of the arguments that generate at home are over, can start over, asking the question, what's for dinner? A first responder, they make critical, high risk, high performance decisions on the job. And it's interesting when they go home and they're asked a question like, well, what's for dinner? And that's the catalyst for an argument. And it's not known. That's an educational piece, and that's what we're trying to do. So what do we do for the network? Well, we created a website. We put all the resources vetted. We contacted licensed physicians for therapy, counselors, psychologists, and we wanted to know that they were culturally competent, trauma-informed, and they understood what a first responder does. I've heard more than a half dozen times that a first responder will access clinical services and that counselor will be brought to tears by the very nature of why they're there to receive services. And we've done things to kind of help with that, and that's by vetting those clinicians. Chaplains, we're talking resilience retreats, AA and NA specifically for first responders, and then also the veterans, active duty as well. The services that are out there, and they're definitely out there. We're offering another option. And we're not trying to replace, we're trying to collaborate with those that are already doing it. We're just creating another venue for that. And there's some others on there as well. Networking, we found strength within that networking concept. I've had several people that are not connected say, this thing's working. And yeah, it is, because when somebody is in need of something and I don't know where to go with that, I will refer them to somebody else. And then that's how that networking has been really impactful for, I want to keep it short, but I have testimonies that absolutely validate what I'm saying. Sorry, I'm trying to dodge a fly here. Our accomplishments, these are just some of them. We established the website. We're doing pre-incident education and training, which should be a catchphrase. It should be, because we don't do that. I've taught, at TMCC with paramedics, EMT intermediates, basics. We cover mostly things that have to do with the customer, who we're serving. But we cannot serve if we're not taught on the front end, hey, you're going to see some stuff, and it could throw you offline. And this is what that looks like, and this is what you need to do to get back into the groove of what you're doing. Hypervigilance has been looked at as a kind of a negative term. It's associated with PTSD, PTSI. Hypervigilance is absolutely what we should be training, because we want them to be hypervigilant when they're doing their jobs. What we need to identify, though, is how do you transition out of that hypervigilant state into more of a thoughtfulness of what you're doing outside of your occupation. We've done a lot of things with donation of money of families of suicide, there's survivors. We try to, when it's brought to us, have an opinion on bill drafts to try to make sure that this is a continued program that is driven by boots on the ground. Not agencies, it's not a checkbox, it's not EAP, it's what the boots on the ground say they need. And that's what's really important. We refer a lot of people to vetted resources. We do workshops for family to try to keep that connectivity there. We do podcasts with Dr. Stephen Nicholas. We do with peer support people to kind of explain and break that mold. And the really exciting thing is the First Responder Resiliency Center. Those of you that know that we've been pursuing this, we got a space, and we are in the process, we are in the process of finding furnishings for this resiliency center. We've been donated a space for 15 months. With that, we are also filling out a grant for private funds for an executive director position, so somebody can be at that post at that resiliency center, and when they come in, that there's a warm person there to help them find what they need. If we need a clinician, they will also be a part of that to do clinical triage. What do they need? Do they need a peer? Do they need a licensed therapist? Do they need a treatment center? Or, you know, maybe it's something much more serious, and we can identify that in a location that's not connected to the agency itself. You can see that where that may be a problem with law enforcement. If they are not fit for duty, or they're having a difficult time with the marriage and they say the wrong thing, they can have their service weapon taken away, and that means they're basically off duty. You know, similar events with firefighters as well as EMS. If they're not fit for duty, that's a stigma, and we're all about reducing the stigma. Our partners, we have a lot of partners. These are just some of them. Military Support Alliance, they've been absolutely passionate about continuing this drive for mental health and wellness for first responders in Nevada. There's a lot of things being said about the network, saying that we are way ahead of a lot of different states. And I would tend to agree, because I was never in competition. I was only trying to fill a huge void out there. When you say suicides have outpaced line of duty deaths in the fire service and law enforcement, in military it's even higher, there's a problem and nobody wants to talk about it. We're changing that narrative. The Mental Health and Wellness Center, we're kind of tagging as the First Responder Resiliency Center. That is the building. Specialty Health has allowed us about 1,500 square feet. There's a couple offices, there's a training room, there's going to be an office and a waiting room, and also an informational, kind of like a resource center. But you'll be able to actually go in and get your hands on a brochure to a vetted treatment center in Arizona, California, Utah, Texas. They're all over the United States, and we only knew of one in the fire service a year and a half ago, and that was the Center of Excellence. That's in Maryland. I personally have been on a plane 2 hours after being notified to get a member there to make sure they got there. We know now that there's other options. So that's what we do. We try to find the best resource for whatever that we're trying to deal with at that time. Specialty Health is amazing to allow us to have this space for 15 months for free. And I really believe that this is just a stepping stone. And the people out there that are like-minded, have the same hearts involved in it, I really truly believe this is just the first step. These are some of the services. We're talking support, resource center. We'll do mindfulness classes and yoga, Tai Chi, whatever the need. The training, the pre-incident education and training is paramount. I put this slide up just to show you that this is what depression could look like. All of you probably recognize some people in here, and they're no longer here because they just were either good at hiding it or having a good day. But I can tell you what, first responders are really good at when they're having a bad day, looking fine. And they'll tell you that. Ask them, how you doing? Good. That's the standard response. And we need to figure out how to break those walls of the stigma down, and it being okay to talk about things or ask for help. So with that, this, if you don't mind watching this 2-minute video, it'll kind of give you a little bit more of a interactive understanding of what the network provides. I'm having a hard time getting this sound up. Give me 1 second here.
Team, a community of first responders. Founded in 2019, A community of first responders came together from multiple service branches to create the Nevada Peer Support Network. Nevada Peer Support Network's mission is to provide quality mental health resources and support to our first responders, hospital healthcare professionals, and military personnel so that they may live the very best lives possible on and off duty. Our first responders and military personnel are the first line of defense, and they always rise to the occasion to meet whatever challenges they face. They engage when there's civil unrest, floods, fires, mass casualty incidents, 911 calls, medical emergencies, and now a worldwide pandemic. First responders and healthcare professionals receive thousands of hours of high-performance training over the lifespan of their careers. However, resilience and mental readiness training are missing from our current models of service. Traumatic exposures are not considered to be part of the job of a first responder, and as a result, mental health disorders are running astoundingly high in this population. This can lead to a less resilient warrior, which makes them susceptible to mental health disorders and broken lives. The Nevada Peer Support Network's First Responder Resiliency Campus is a safe place where those who serve can go for a variety of support resources, such as mental focus and stress reduction, physical health, educational opportunities, support groups, clinical services, and a resource center with coaching and literature, ensuring that our warriors have quick access to vital mental health and wellness resources should be a priority in every community. Financial support is needed to reach our goals to launch Nevada's very first resiliency campus for first responders. Donations can be made through our website at nvpsn.org. Click the donate button and help us serve those that serve.
All right, thank you very much for, I do want to quickly speak to our southern partners and also rural Nevada. We have not forgotten about you. Actually, we're just getting started. Our desire is to have a resiliency center in the south and in the rural communities. So with that, thank you for your time. If you do have any questions, I'm all ears. I know you don't want to run your meeting long, but you can also contact me. I'm going to throw an email out there real quick. It's nntsn775@gmail.com, or you can call me directly at 775-560-6042. Thank you again for the time that you've given me.
Derek, thank you so much for that presentation. It's a obviously item that has come to the forefront more lately when you figure that we have more troops that have committed suicide than got killed in combat. And, you know, as a former law enforcement officer, so many retired law enforcement officers end up committing suicide, and kind of reminds me of the Homeland Security thing. If you see something, say something. And it's really important it's pretty obvious sometimes when you see people that are struggling. It doesn't take anything on your part just to go up and say, hey, what's going on? You know, are you okay? I mean, and I think that's what Derek's making that. So with that, in the interest of time, thank you for your presentation, and we'll move forward.
Thank you, sir.
Okay, 10 for possible action, review the FY22 budget and possible action to form a working group to explore an increase in the state EMS program fee schedule. And Bobbie's gonna talk about this, but you know, we've talked about this and we have the lowest fees of anything that you can think of. So nobody wants to hear about an increase in fees. That it reminds me of our EMS workers, that we have people that are working EMS and saving lives that they can make the same amount of money working in fast food. So, you know, there are definite issues here. And Bobbie, if you do this presentation, please.
Thank you, Mr. Chairman. Bobbie Sullivan for the record. Cody, are you still with us?
Yes, ma'am, I am.
Okay. So we have the budget, and Mike, I believe you have the budget on your screen that you can share with the group. We are currently in the middle of the FY22 budget year, and at this time we're working on budget 24-25. And as Dr. Carrison said, we do have some of the lower fee rates for applications, permits, and et cetera. We've done a sister survey of fees charged by similar states. We've collected that data and we're putting it into a finalized report. In fact, that was one of Douglas's first projects when he came on board, is to work on that. So as we're moving forward, if this group elects to form that working group, we do have data to help that decision process for any recommendations that might come from that group.
And I think it's important for the chiefs, because the chiefs have their budgets for all the fire departments, and it's not just the chief that does that. It's an administrative function of any department, EMS, fire, law enforcement, whatever. And I think a comparison of where we are is really important. But is there any member that is really interested in working on this budget matter? Don't all speak at once. Well, in any event, we have that, and I won't volunteer.
Mr. Chairman, this is Steve.
But Chief Nolan has a lot of experience in the area of the state and the bill draft requests and everything, and also that connection with the rural chiefs and the chiefs that aren't associated with Clark County. So we get together because they're affected, and I get it that small departments are more affected than large departments, but this is if we're going to have a viable working state EMS committee or department, then we're going to have to do something, because we have people, we need more positions, and you all know that. So with that, I'll let it go. Bobbie, you are.
We would be happy to help with any of that information or provide any information that we can to a working group to look at exploring. That's something that we've been looking at, and any suggestions or recommendations would be greatly appreciated.
Okay, offline, if anybody would, text me or contact me with regard to your interest in this, it'd be truly appreciated, because it is something that has to be done. And if the EMS office just goes to it without doing groundwork and working with the different agencies, it will not be successful. We need to work with the different agencies and make our point that we need this resources so that we can be more efficient and help them in a better way through the state EMS office. And without funding, that can't be done. Comments? With that, we'll go to item next. Number 11 for possible action. Discussion and possible action to create a working group and review, update EMS Advisory Commission rules of order. That's by me. What we wanted to do is just go over this. I think we've already kind of discussed this today about the committee and how it is and what we can do to update this. And I mentioned that in that just the terms and who we're going to include. And the chief, I apologize that brought this up. We have multiple groups in the state that aren't represented that this committee works with and that this department works with on a regular basis. So I'm making a plea that if you have an interest in this, please let me know personally, and I'm going to work on it personally so we can try to make this a more efficient group and more inclusive without making it so inclusive that we become unworkable, which could happen. If you get too large of a committee, it can be unworkable, and I think that's been in the past. But we've also increased the population centers in the rurals. There are more people than there were. It's still growing. And we have areas of our state that aren't truly represented on this committee, and I would like to see that change. So thank you. Any comments? Okay, thank you. Item next, informational only, discussing regarding open meeting law, ethics, and government training materials for members. Is there anything on that, Bobbie?
That item, Mr. Chairman, Bobbie Sullivan for the record, that item was placed on there in case there was any follow-up to the meeting from June. We have Perrin Takis, our Deputy Attorney General, joining us. She had sent out the information, so Perrin, I'll let you pick that one?
Sure, of course. Hi, everyone. Piran Takis, Deputy Attorney General for the record. I had sent out the Attorney General training materials that we do have posted publicly online to all the members of the committee for independent review. I just wanted to plug again that if anyone has any questions regarding the open meeting law or the ethics and government provisions, you're always welcome to email me and ask those questions. Also, just one update, and I included this in my email as well, but just so everyone else knows, there was a change in the open meeting law this past legislative session. It was AB 253, and it basically puts into law the allowance to have meetings via Zoom or Teams remotely. So there are a few rules that, new rules that apply to those, but it allows this committee to continue having meetings remotely if it so desires. It can continue to have a physical location and do it remotely. So members of the public and members of the body have the option to appear in person or remotely. One thing that I will say, just that I've seen and experienced, best practices would be for members of the board to keep their video on. I know that not everyone has the capability to do so. It's not an explicit requirement of the change in law, but it is something that can help the body stay accountable to maintaining a quorum. It's a bit easier when you're all there in person to see who leaves the room, or if someone runs to the restroom and quorum is lost. It's a little harder to keep track of that when it's via the web. So to the extent possible, I do encourage members to use their video whenever possible. And then also included in the training materials was the ethics and government provisions. This relates to conflicts of interest. If at any point something comes onto the agenda where you feel that you might have a conflict of interest, please email me and we can work through it together. When you are required to abstain due to a conflict of interest, it requires that you go through that with legal counsel to make sure that you are required to abstain. There's an option. There's certain scenarios where you just have to disclose your interest, but then there's scenarios where you have to disclose and you have to abstain. So I'm always happy to work through those issues with all of you. So that's my quick high-level overview of what I sent. If anyone has questions now, I'm happy to answer those. And if not, you're always welcome to email me.
Questions from Ms. Takis? Well, as always, thank you. Clearly, the chair clearly recognizes the importance of this issue, because anybody that reads the national news knows that there are difficulties with this throughout the United States, and we don't want to be part of the difficulties. So we'll use you, and thank you.
Perfect. Thank you.
Possible action regarding advisory committee applications for the vacant position of an individual who is, quote, employed by or serves as a volunteer with a medical facility that is located in a rural area that provides emergency medical services, unquote, as set forth by NRS 450B 151-3F for a term expiring June 30th, 2022, for possible action to make a recommendation to the State Board of Health for appointment. Ms. Sullivan.
Thank you, Mr. Chairman. Bobbie Sullivan for the record. For this open position, in the last conversation I had with Jenna, our administrative assistant, we had not received any interest for this position. I don't know if there's anyone here today that is interested in approaching the board for that position or not.
Are there any members who, we're talking employed by or serves as a volunteer with a medical facility that is located in a rural area or provides emergency medical services? So if you know of anyone, that's another way to be a little more inclusive and have someone else. And we'd appreciate having that word out. It has been posted and we've had no applications. So it's like we're missing that representation that was brought up earlier. This is one more way we can have that representation. Okay, hearing no applications, we'll move forward. Item 14, informational only, update and discussion relating to the recommendation that continuing education course coordinators' entry of attendees to the image trend suffice for the verification of completion in place of physical certificates of completion. Ms. Sullivan.
Thank you, Mr. Chairman. Bobbie Sullivan for the record. At this time, there's been no change in that. The certificates still need to be issued by the programs. Image Trend, as part of their update last week, has taken a significant undertaking of updating the education portion of it. So as it stands right now, we are not in a position to make any changes to that portion of the database at this time.
Okay, thank you for that. Item 15, informational update and discussion regarding importing commission on accreditation for pre-hospital continuing education, CAPC, courses into Image Trend. Again, Ms. Sullivan.
Thank you, Mr. Chairman. Bobbie Sullivan again for the record. There has been no update on that issue because it comes back down to third-party access into a database system. So we're keeping that on our radar, but there has been no changes by those two groups.
Okay, so essentially we'll just keep that, that item doesn't have to go back on every time unless we have a change. If we have a change, then we'll add that item to our agenda.
Okay.
But without a change, why, it's just more fluff right now. Item number 16, informational only, update and discussion relating to the recommendation that state EMS office develop a policy and procedure on statewide communications to identify leadership changes. Ms. Sullivan.
Thank you, Mr. Chairman. Bobbie Sullivan. This is part of the tasks developing updated policies and procedures. It's one of the tasks that we're going to involve Douglas with. So that project is still underway.
Mr. Chairman, Bobbie Gola for the record.
Yes, Bobbie.
Just real quick, going back to removing these items, I've just kind of asked that they've been kept on so we can follow the status updates on them because I don't want them to get lost in translation. And so that's kind of why from agenda, I've kind of asked that they remained on just so we can get like little updates of like where are we at with these particular items.
Would that suffice, Bobbie, if we just, but again, if there's simply no change, we can just put an item on and Ms. Sullivan can say no change. If we get a change, then we need to have the item on and it needs to be discussed. I agree with that, but.
Okay, I might have just misunderstood. Maybe I thought you were having it removed from the agenda or just to say no change.
I think what we could do is just put it under Image Trend because both those items are under Image Trend, and we'll just ask Ms. Sullivan if there's any date on Image Trend. We can put that as an item on the agenda and we'll just make it as Image Trend. And that way she can follow it and advise us if there have been any changes. How would that work, Bobbie?
Yeah, that sounds good. Understood.
Okay. So this is a time for public comment. Do any members of the committee or any members of the public have public comment to make at this time? Well, the chairman would just, since this was my first meeting, and I told Ms. Sullivan I'm not capable of doing this in my house because I'm not electronically fit to do that. So thank you for allowing me to be here and do this. Bobbie, is there any update on when we think we'll have meetings in person again?
Meetings in person have been authorized since earlier this year. I think that was the discussion that was brought up earlier. So in-person meetings can take place.
Okay, so if you wish in-person meetings, when the agenda is sent out, then we need to have you notify us so we can make arrangements for the in-person meetings. I plan on being in person as the chair simply because of the electronics are so much better here. Any questions with regard to that? So now we have a very difficult issue. We have to schedule a fourth meeting. NRS requires us to have 4 meetings. We were going to have it next week, however, because of Nevada Day, that took a day off the posting requirements and we're unable to have that. So we'll send a survey out to the members and look at 2 different dates to see if there's 2 dates that are possibilities that if you can look at your calendar would be the Wednesday before Thanksgiving, which would be the 24th of November, or the 1st of September, which is also on Wednesday, or I'm sorry, December. Misspoke. So please, a survey will go out. Please provide your input. We need to have a quorum, and Nevada revised statutes requires that we have 4 meetings a year. So this is not a meeting of choice. It's something we have to do, and we want to make it possible for all the members to obtain, so we have a quorum and we can have a meeting. Also, please submit your other items that you would like for consideration on the agenda.
Mr. Chair, Bobbie for the record.
Seek a motion for adjournment.
Mr. Chairman, Bobbie for the record.
Second.
Mr. Chairman, there, Bobbie, I think, had a comment.
I think he made a motion for adjournment.
No, sir, I had a question.
You had another one? I apologize, Bobbie.
Yeah, so I'm not sure what happened, and this might be just asking if Bobbie might be able to help me out with this. I wasn't on the last email chains for the committee stuff. I actually had to get notifications from the chairman, so I don't know what happened, why I wasn't included in those emails, but I know you're just sending out a survey. I just want to make sure that I'm included in that email this time.
Bobbie, my apologies, Bobbie Sullivan for the record. I will follow up on that and see what the issue at hand is.
Thank you.
Okay, is there a second to the motion for adjournment?
Second.
Second, and all in favor?
Aye.
Aye.
Right, the meeting is adjourned. Thank you, everyone.
Thank you.
Thank you. Good job.
Somebody wants to be on the committee with regard to the rules and testing.
Okay.
Thank you, everyone. I can't wait to get outside and get this thing off.